Hello, everybody. Today we are here with the second part two of the cardiovascular system. So let's go ahead and just dive right in and check this out. All right, as always, you'd be so kind to like and subscribe if you haven't already to the channel. It really helps me out and gives me the ability to produce or bring you more content. And as always, too, please, if there's anything that you are not seeing on my channel that you'd like to hear about, or you have questions or anything like that, please let me know in the comments and I will try to answer those or get some new content out as quick as possible for you. All right, so let's go ahead and check this out. In the previous part one, we talked about the pieces and the parts of the cardiovascular system. Now we're going to talk about kind of what it does, how it works, and the various issues that can arise. So blood pressure, let's kind of explain blood pressure. A lot of people don't understand. I mean, they know they put a thing on your arm and they squeeze it real hard and they listen and then boom, there's a number. Most people don't understand what all that means. And I'll be quite honest with you. I think a lot of healthcare professionals don't really understand it fully. They know how to take it, but if somebody said, "So what exactly are you measuring?" I don't know that they'd be able to explain it. So I'm going to explain it to you, and I hope that that will help you understand. And if you ever do get kind of caught on the carpet to explain what it is exactly that you're measuring, you'll be able to explain it. So blood pressure is just that. It's the force of blood on the walls of the arteries. Okay. Because remember, as I had said in the previous video, the heart is pumping the blood out through the arteries so it can take it to the rest of the body. So the arteries are under enormous pressure. Okay. Um, as ventricles contract and relax, the arterial pressure rises and falls. Now, keep in mind, if you were watching in the last video and we went through the blood flow and how everything gets pumped, if you noticed, the ventricles are far larger than the atria are. Okay, the upper chambers of the heart are much smaller than the bottom chambers are. That's because the ventricles do all the heavy lifting. Okay, they're the ones that are pushing the blood out into the lungs. They're the ones that are pushing the blood out into the aorta to go to the rest of the body. So they have to be a little stronger, a little bit bigger. They have more muscle around them, more myocardia. Um, the atria are just there basically to receive the blood and to get it to the ventricles. So as the ventricles contract and relax, that's when you get that real sense of rise and fall in pressure up against the arterial walls. So when we look at a blood pressure, when we measure a blood pressure, we're looking at the systolic pressure over diastolic pressure. That's how it's recorded, right? Systole over diastole. Systole is contraction. It means contraction, okay? And during systolic pressure or during systole, point of contraction, that is the highest point of pressure in the arteries because things are contracting, the heart is contracting, therefore pushing the blood at its hardest, basically, which is causing the pressure on the inside of the arteries to be at its highest level. Okay. Diastole is when the ventricles relax. So even though there's still a little pressure because there's still movement of the blood through the arteries, that is the lowest point of the pressure. So basically, what you're recording or what you're measuring and then recording is the highest point of pressure over the lowest point of pressure. Okay. And that is recorded as systolic pressure over diastolic pressure. Now, there's factors that obviously affect blood pressure. Besides those factors that we normally talk about, like age and weight and whether you smoke and things like that. Cardiac factors, right, is what I like to call those. But the factors that actually affect the pressure itself beyond that is cardiac output which inevitably can be affected by those other things, by those cardiac factors like social behaviors and high cholesterol and things like that. Blood volume, although I put booed volume. Oh, boo. I'm having some issues today with PowerPoints. I apologize. Blood volume. So how much volume is there? Because the higher the volume, the higher the pressure. Vasoconstriction and vasodilation. So are the vessels getting smaller or are they widening? If they're smaller, the pressure is going to be higher, like when you crimp a hose, right? A water hose. If they dilate, it's going to be bigger and the blood is going to flow more freely, therefore a lack of pressure. And then viscosity. How thick is the blood? If the blood's super thick, it's going to be like syrup and it's going to flow much slower and therefore have more time to build up pressure. If it's more watery, so to speak, it will flow more easily. So those are things that can affect blood pressure beyond cardiac factors like age and weight and um, gender and social behaviors and how we eat and things like that. All right, I hope that helps with what we're measuring with blood pressure. So let's talk diseases and disorders. There are quite a few. I took the big ones on, the ones you see most often, and the ones can really be a problem. So first we have aneurysm. And an aneurysm is just basically a weakened artery. Because as I had explained in the last video, the arteries are tougher, thicker, because of the pressure put on them. However, if they weaken, they can balloon. And unfortunately, there's really no symptoms usually unless a rupture occurs. And if a rupture occurs, you got problems. So that is an aneurysm, and those can happen anywhere where there's an artery. Angina is chest pain due to a lack of oxygen to the heart. It feels more like a squeezing than anything. It's like a choking. Usually this is caused by arteriosclerosis or a buildup in the arterial wall of cholesterol or fatty deposits that is causing a lack of blood flow. And when you have a lack of blood flow, you have a lack of oxygen because that's what it's carrying. Usually this is brought on by exertion for people who have this issue or have heart issues. Congestive heart failure, or CHF, is a condition that develops over time. The heart can't pump enough blood to the body. There's cardiac risk factors that are involved in this. And most of the time, the symptoms are shortness of breath, fluid retention that then causes swelling in the extremities, especially the lower legs and the feet. So usually they just try to manage the symptoms of congestive heart failure because there's really not much you can do otherwise. And that's by like giving diuretics to take down the fluid retention, and similar things. Coronary artery disease, or CAD, is an accumulation of fatty deposits in the arteries due primarily to high cholesterol. Usually, unfortunately, there are no symptoms other than hypertension until a heart attack occurs of coronary artery disease, unfortunately. Dysrhythmias are abnormal heart rhythms. There are so many, we would be here for days if I tried to name them all. But it's basically when the heart just does not beat in a normal way. And that can be various things. That can be having extra beats or having skipped beats. There's a ton of different dysrhythmias out there. Most of the time, they're not noticeable. But if they are too bad, they can actually cause things like dizziness and shortness of breath and even chest pain, mimicking a heart attack. Hypertension is the medical term for high blood pressure. High blood pressure or hypertensive is generally considered 140 over 90 or higher. Can be controlled with medication. Sometimes can't be completely reversed, but can be helped by changing diet, getting more exercise, things like that. Um, Hypertension is actually very, very common, especially in the US. Um, and it can cause many issues, stroke, heart attack, headaches, okay, dizziness. So hypertension is nothing to mess with. Mitral valve prolapse or MVP is a dysfunction of the mitral valve in the heart. This can cause palpitations, heart palpitations, shortness of breath, chest pain. There's not much you can do for it other than surgically repair the valve. They've even there's even procedures out there where they can replace the valve. They usually use like pig valve and stuff like that. Because ironically, pigs are their tissues are very, very close to humans. We always think, gorillas and apes and stuff are closer to us, but in reality, our tissues are more like pigs. Myocardial infarction or an MI, that is the fancy name for a heart attack. During a heart attack, you usually have non-reversible damage to the heart. It can lead to death. And most of the factors that contribute to a myocardial infarction are cardiac risk factors, such as high cholesterol, obesity, hypertension, smoking, drinking, just all the things. Um, Most symptoms, which I did not list here, I would have used up way too much of my slide. Most of the symptoms of a myocardial infarction include chest pain almost always. That chest pain can radiate to other places down the arm, into the back, up into the jaw. Um, Shortness of breath, diaphoresis or unexplained sweating. Um, the patient can become pale, dizziness, nausea. There's just a lot of various symptoms and signs that come along with an MI, but they don't have to all be present for it to actually be an MI. Myocarditis is an inflammation of the muscular layer of the heart, most commonly due to a viral infection. Can also be due to exposure to chemicals or bacteria. And then pericarditis is inflammation of the pericardium, again, caused generally by a viral or bacterial infection. Sometimes even an allergic reaction can cause myo or pericarditis. All right, so that is all for me. I hope you enjoyed the cardiovascular system. I know it's not, physician level explanation. I didn't want to bore you out of your mind going into that, but it's what an MA needs to know. And for now, I hope that I have given you a little more insight and possibly a little help in what you're already learning, or even, just kind of giving you insight into what you already knew. So thank you so much, and I will see you all next time. Take care.